How to engage aggressive youth in treatment. The training summary. This training is designed to assist clinicians in understanding, managing physically aggressive behaviors in children and youth. Clinicians will be equipped with the ability to better assist youth served by utilizing techniques that will be covered within this training. Some of the training objectives: clinicians will assist with or will learn the approaches with managing children with aggressive behaviors, and it depends on the child's developmental stages. Clinicians will be able to define aggression in children and youth, and clinicians will develop a greater understanding of the factors that contribute to aggressive behaviors in children. Clinicians will learn a variety of techniques that will assist them in managing aggressive behaviors, and we'll also learn some resources and strategies for self-care to assist them in dealing with aggressive behaviors within youth. So why do children explode? So many children are not able to comply with expectations because of different developmental delays, different trauma that they've been exposed to and that they may have experienced. They have the lack of skills that they need in order to be successful, and they don't have the proper role models. So with each child, it could be a different circumstance, but all children are not made the same. They can have different triggers that could come from the home, the school, or the community, but also keeping in mind that with specific diagnoses, something such as attention deficit hyperactive disorder, which is commonly diagnosed, children are commonly diagnosed with, it's only an appropriate diagnosis when the behaviors are prevalent within the home, within the school, and the community at the same time. If these adverse behaviors are presented within multiple domains at the same time, then it is appropriate for that individual to have the diagnosis of attention deficit hyperactive disorder. Youth issues: a lot of the youth are poor communicators. A lot of their issues that they have tend to be less verbal as well, so they don't communicate their issues. They have lower than average intellectual functioning in many instances. They have anger issues, difficulty with change, difficulties with relationships and or attachments. Dynamics of some of the aggressions I'll review. Research demonstrates that adjudicated youth feel that they have little or no control over their own lives. And those youth often feel that they cannot make decisions on their life. Many youth have been moved on a whim. They are frustrated and angry at the system. They blame their parents, case managers, therapists, foster care parents, school teachers, judges, and anyone else they believe is responsible for their own unhappiness. And research also shows that they feel there are two ways they can take control over their lives: so passive resistant or being physically aggressive. Other dynamics of aggression: they may have seen aggression modeled by their family members and they just want to mimic it. They may have experienced with aggression as a behavior and continue to use it. They may have a physiological problem and it may be more difficult for them to manage their emotions. Progress in this area requires a longer view. Immediate consequences often do not provide immediate change. Some reasons for aggression in youth: they may have witnessed domestic violence. Mom or dad or another family member may have injured another family member, and that may be their way of resolving issues. One or more parent may abuse substances. Environmental violence and aggression within their neighborhood, they may witness that. They may have witnessed violent acts on a regular basis, and sometimes they may normalize abnormal types of interactions. They may themselves be victims of violence. Current social issues, so being exposed to storms or experiencing racism, politics, just different local tragedies that they experience on a regular basis. It gives them that opportunity to normalize those abnormal behaviors. Crisis prevention, crisis prevention planning takes place early in a case. So considers a child's past experiences, include input from the child's caseworker and others that are involved in the child's care. There are gender differences. Girls internalize their victimization. They would cry, shut down, become more emotional. Boys externalize their victimization. They can become aggressive, fight, and then verbally be disrespectful and be non-compliant. But we know with the first one, girls are no longer internalizing their victimization. They're also externalizing victimization through the same ways of becoming more aggressive and fighting and being verbally disrespectful and non-compliant. Here are just some skill building activities that you can consider with working with children that are aggressive. Let the youth know trouble can become addictive. So these are some examples of things that you can do with group work. Let them choose two types of worlds. The first world is one that is peaceful, where people live together, they care about each other. World number two is a world where it's violent, people die, they use drugs, and they're homeless, and ask them to choose which world that they would want to live in and why, and have them explain that. And why not? Why wouldn't they want to live in the other? So this could really spark a good group conversation, and the youth involved in the group can share more of themselves and their experiences and their worlds where they live in. Another skill building exercise is make it interesting when you're doing groups. Use cognitive behavioral approaches, promote mutual aid when youth help other youth with problems they're helping themselves at the same time. So it's universalization is the clinical term, and help develop anger and impulse control. There are good ways and bad ways to deal with anger. So ask them a question. What sports player do you know handles a bad call well, and how? Give me an example of when this occurred. They can really start thinking about it and processing this and giving you examples. Pre-blow up, set up youth or the child for success. Assess what medications are they taking? What are some of the side effects that does the medication have? Observe the child or the youth. Determine the baseline and record it on a calendar or within your notes. Document the youth behaviors on that calendar. Give clear, short instructions when a child is frustrated or upset. Put your irreplaceable things away or in storage to help you stay calm. You don't want them to break it and then you get set off and you're feeding into their aggression. And steps for practicing with youth. Describe the behavior you're trying to teach them. Give them a reason using an if and then statement. Demonstrate the behavior for the child and have the child in the behavior and practice. And then reward. These are some steps, 5 steps to problem solving. So first you want to define the problem with the youth. When you're talking with them, define what's the issue. Brainstorm the different alternatives that can be implemented. Choose a solution. Obtain a commitment from them, and then evaluate the results, and then repeat if required. Things to remember: do not walk on eggshells or let youth or children train you to accommodate their behaviors, because children are opportunists. They'll do it all the time. You will do the work either now or later, which is what you want the youth to do. But either way, the work is going to get done. Have low tolerance with small consequences. If you consecrate interrupting, name calling, and yelling, then you will deal with less physical aggression. Negotiating is okay as long as it is not bribe or blackmail. A bribe is a reward which comes before the behavior. During the blow up, stay about 10 feet away from the youth. De-escalation begins with delivery of consequence. Youth may have a tantrum to avoid a consequence. Deliver one consequence, additional chores, or lose privileges for the day, Don't pile consequences on or think that delivering a consequence will result in compliance. And steps for calming down a youth: express empathy or praise when it's appropriate. Describe behaviors that you need them to stop, like yelling, swearing, or stomping around. Describe what you want them to do. Give them short instructions. Use a pleasant voice. Don't expect compliance, but praise appropriateness. And repeat first three steps until you calm down, until the youth calm down, and allow them that space to calm down. So really just assessing the situation, defining that problem, telling them what behaviors that you need them to stop, describe what you want, and then repeat those steps. And it should be able to help you with working with youth that exhibit aggressive behaviors. So I hope that this presentation helped, and I wish you luck with working with these individuals. Thank you.